Hi, this is Dr. Robert Lin, founder of IQ Laser Vision. Thank you for considering us for your vision correction needs. Today we're going to talk about the EVO ICL. It's a great technology for patients with higher prescription, drier eyes, abnormal shaped cornea, weaker corneas, or anybody who just wants the best quality of vision. The patient satisfaction rate is 99.4%, meaning that patients will want to have the procedure again if they had to choose again. In terms of the longevity of the EVO ICL, it's been in studies since 1980s. The first human, my friend, Dr. Zaldivar in Argentina, placed the first ICL into a human in 1993. That's when LASIK was developed. So there's a long track record of the material, which is safe to be used in the eye for about 40 years. In the FDA trial, which was performed in 2005, we used the method of white to white in order to size the ICL. And before, the ICL had no hole in the center. This lens had great results, but there was a little bit of a risk of a cataract, about 1.4% in the FDA studies. And we were concerned about the lens fitting exactly perfectly in order to minimize the chance of increased pressure. Since then, with the new EVO ICL design, which has a hole in the center, the risk of cataract is pretty much zero. That being said, we want to be able to place the ICL with the most amount of accuracy. So at IQ Laser Vision, we're one of the few centers in the whole world that has the ArcScan Insight 100. This technology allows us to measure not only the white to white, but actually behind the eyes here, in this area is called the sulcus. And the ICL will sit into the sulcus in this area right here. So therefore, we are able to leave enough room between the ICL and the crystalline lens, which is right here. And also it does not push on the iris enough to narrow the angle. So what we found is the most important is not the ACD, which is the anterior chamber depth, which is from here to here. The FDA study was very focused on that, saying that if you have an ACD of greater than 3.0 millimeter, then those are the people that were allowed in the study. Now, that doesn't mean that if you're below 3.0 millimeter from this ACD, it's not safe to perform your surgery. However, it wasn't studied in the FDA clinical trial, and that was in 2005, which is 20 years ago. Since then, in Europe and in Asia, they have approved it for 2.8 millimeters of ACD. Now, even people that are lower than that, it does not mean that you don't qualify for it. It's just that it wasn't studied. Now, since then, there have been tens of thousands of people that have lower ACDs that have safely had the ICL. And the reason is because we were able to size the lens properly. And what we look at is really not the ACD. The more important criteria is the angle here, okay? The angle from the iris there to the cornea. And that angle is the most important. If we keep the angle above 15 degrees, there's minimal chance that there'd be an increase in pressure that can lead to glaucoma. So we will be monitoring the pressure throughout the whole postoperative period, and annual exams are necessary whether you have ICL or not. In order to examine the angle, we have different types of machines that can allow us to measure that. So for example, just the routine topography typically has an angle here, and this person here had a 31-degree angle, which is a little bit on the lower side, but in the average range. Their ACD was actually here 2.82. As I mentioned, the most important is to see how much this angle narrows after the procedure. If we place an ICL, the angle will diminish by about 15 degrees or so. So in this person, we likely will be able to perform the ICL. Now, if we see that this patient does not have an astigmatism correcting lens, we can actually size the lens a little bit smaller so that there's less reduction of the angle. So how are we able to achieve this amount of accuracy? Again, it goes back to the ArcScan. So in this picture of the patient's eyes, and has all the parameters where we measure the sulcus, which is where the lens is supposed to go, and a lot of other parameters here. You can see from all these numbers, we extract all these numbers from this ultrasound scan. There's a robot that actually measures all these numbers, and it's inputted into this matrix here. Then we input it into a special program and all these variables, and then it predicts what the volt will be after the surgery. That's how far the ICL is from the natural crystalline lens. Okay. The most important factor is to determine what is the post-operative angle. As long as it's above 15 degrees, as I mentioned, that's what the experts throughout the world have decided is the number that we want to be careful about. Other parameters that we look at, we also look at the endothelial cell count. Okay, so there were some concerns about endothelial cells and how many endothelial cells were being lost during the surgery and then after the procedure is performed. With the EVO ICL, we have not been seeing a decrease in the endothelial cell count over time. Naturally, we lose cells at a particular rate between 0.6 to 0.8% per year. But with the EVO ICL, this version, we haven't been seeing a decrease compared to not having the EVO ICL. But based on the technique of the surgeon and the patient cooperation, we found that the reduction in endothelial cells during the surgery is between 1 to 10%. Fortunately, at IQ Laser Vision, with our experience and our techniques, we are on the 1% range. In terms of ICLs being placed into the eye and needing a removal or exchange to a different size, we're happy to report that our exchange rate is probably the lowest in the world at about 0.3%, 1 in 300. And that's because of our ArcScan technology. There is also some new papers that came out that shows that placing the lens ultimately into a vertical orientation keeps the lens more stable, less chance to rotate. The reason is because the eyeball is actually longer in the vertical direction for most patients. So the lens likes to stretch out into that vertical direction, and then it doesn't move as much. It's not that the lens is moving every day, every time you blink like a contact lens, but sometimes when we place it in, it'll rotate to a different area. So in the vertical orientation, we have less chance of that based on some published reports that came out this month. Even having the vertical and horizontal orientation of the lenses to choose from, we actually double the size of lenses that are available, because there's only 4 sizes of lenses, but now if we could put it vertically or horizontally, now we have 8 sizes to fit into your eyes. Now, it's most important when you have patients that have astigmatism, because then you have a toric lens, which means it has a direction to it. This is where rotation is what we want to minimize, because rotation of the lens can cause the vision to decrease. If you have a spherical lens, we don't have to be as exact. We just need to put it in a way that it's farther enough from the crystalline lens and not too large so that it pushes on your angle to reduce the angle. So for patients that have no astigmatism or very little astigmatism, we put a spherical lens in and we can size it a little bit smaller. Of course, if you have a little bit of astigmatism, like 1 diopter or less, I will also manage the astigmatism by strategically placing the openings that we use already naturally to perform the surgery, and that will neutralize the astigmatism. So these are some techniques that reduce our chance of exchanging the lens. The last technique is sometimes we will do one eye first and wait a day or 2 or a week afterwards to do the second eye if you're in between sizes of the lenses in one of the eyes. We are able to get probably one of the lowest in the world in terms of needing to exchange the lens. We're very happy to have these innovations in technology at IQ Laser Vision. We've been performing ICL since 2008, and we're currently the #1 center for EVO ICL and also for SMILE in the United States and actually in all of North America. So thank you for trusting your eyes with IQ Laser Vision.